Hello. Today I am bringing out another topic, that is sinusitis, or say let us say sinus and its problems. First of all, most of my patients come to me and say, "Doctor, I'm having sinus." So I think how you are expressing is not very right. Some people having a headache, say nose block, sneezing, nose running, facial pain, headache, neck pain, whatever, any problem in the head area, if it is related with some nose complaints, they call it sinus. But what exactly is sinus? Sinus are cavities in the bone of our skull. That is, the skull is the bone of our head. Here we have sinuses, as I'm showing on the side, the maxillary sinus around the cheek, and in the middle of the nose we have ethmoid sinuses just beside the two, in between the two eyes. Okay, and above the eyes we have frontal sinus on both sides, and behind, deep inside, we have the sphenoid sinus. So these are the group of sinuses. And what exactly is a sinus? Sinus means there is a cavity inside the bone, and these cavities inside the facial bones, they are lined by mucous membrane, and this mucous membrane produce fluid. We call it as mucus. These mucus secretions, they are slimy secretions which comes out also through the nose, that you must be getting it. When you are having too much of this discharge, it will come out in the nose and you can feel it. The nasal discharge, these are slimy discharges. Okay, so this mucus lining, mucous membrane lining, they produce mucus, and they have to be drained out into the nose cavity, and from there it goes behind into the throat. So these sinuses are being kept moist and functioning by the mucous membrane. This mucous membrane has got mucous secretions. At the same time, these mucous secretions are usually brushed out or cleaned by cilia, that is hair cells, which are hairs above the mucous membrane lining cells. They are used to wipe out the nasal secretions inside the sinuses into the nose cavity, and from there it is thrown back into the throat and it is being swallowed. Or sometimes if it is too much, it is coughed out or say blown out through the nose. So these are sinuses. But what exactly we are complaining as sinus or problem of sinusitis are nothing but nose problems. So what exactly are the problems that we face when we have sinus problems? When there is infection in the sinuses, we have this sinusitis. So how infection comes? I've told you that there are secretions inside the sinuses which are to be drained, and it also keeps the nose cavity moist. So once this drainage is blocked, either by some changes in the structure of the sinuses and the opening of the sinuses, if the sinus opening is narrow by allergic reactions or by any anatomical defect, it leads to blockage of the drainage pathway of the sinuses. It is just like when there is a river flowing or a nala flowing, and if it is blocked, the water flow is not proper and water starts retaining. So this retained secretion inside the sinuses create heaviness, and sometimes you may have heaviness in the face, and when you bend down you have more heaviness in the head and the facial area. And once the infection starts there, because of all the microflora that we have, the bacteria and others inside the nasal cavity and the surroundings, it becomes infected, and then it starts paining and a throbbing pain sometimes if it is too much blocked, and some febrile conditions or fever also comes up. So when you are having nose stuffiness, then facial pain, which is more on bending down, and also combined with some fever or mild fever, and sometimes throbbing headache, it gives this diagnosis as sinusitis. So these are the sinus problems. So how to deal with these sinus problems? First of all, we need to diagnose. The most important diagnosis is from number one, from history. What you are complaining comes. Okay, next one is by endoscopy examination into your nose. Nose endoscopes are used to examine inside the nose to find out whether there is any secretion, which is whitish secretion, sometimes some foul smelling secretions going into the nose, then into the throat, which can be seen by opening the mouth or inside the nose cavity we can see. And this also properly seen with the help of endoscope, which is introduced into the nose. So posterior nasal drips from inside the nose into the throat and seen by endoscopy, and there is inflammation, swelling of edema in these areas. Then only we will be able to diagnose it as sinusitis along with the history. So to confirm the diagnosis, we need three things. One is history, another one is endoscopy examination, the last one is CT scan. In CT scan, we find there is blockage in the sinuses, there is haziness. Usually the sinus openings are very black in color, but once it becomes whitened or say it becomes hazy, then we diagnose it. We call it as radio opacity. This radio opacity will not be just like the bone. Bone is too much white, but it is slightly, dense tissues, Then this, sometimes we may even get a fluid level, that is a level of a fluid. Okay, so if we find these cases in case of the CT scan of the sinuses, then we diagnose as sinus infections. These are treatable first by antibiotics, then decongestants, but in the long run, if it doesn't improve, we may have to wash the sinuses by puncturing the sinuses, or that is in acute stages. But in the chronic stages, when there is recurrent infections in the sinuses, is mainly due to blockage of the sinuses. In those cases, we do endoscopic sinus surgeries, which can be two types. One is invasive, another one non-invasive. Non-invasive is we use the help of some balloon catheters just to dilate the opening of the sinuses, which will facilitate drainage, and sinus problems are cured. Or we can just use the help of endoscopic sinus surgery. We just do a surgery to dilate the opening of the sinuses, and sometimes some sinus cavities like the ethmoid sinuses may be too much diseased with polyps and all, then we may have to open out these sinus cavities and kept it open. That is how we treat sinuses. So first of all, what you need to know is that if you are having allergic problems like coughing, sneezing, nose block, and itching in the throat, eyes, and ears, it is just plain allergic problem. For that, you just refer to my video, allergy and immunotherapy. So allergy is nothing, which is just a reaction to the allergens. Okay, but sinusitis is an infection. But all the headaches are not sinusitis. So you have to, when you are having headache which comes off and on without any fever, then there should be something else. But if it is along with some fever and some malaise and all, then you have to approach a doctor, then get it treated. This much for today. Thank you very much for listening and encouraging me once again. Thank you. Bye-bye.